Professor Grant Blashki, and we're at the Doctors for the Environment conference in Melbourne. Can you just let us know where you're from?
Sure. Well, I'm a GP. I work in St Kilda, Melbourne. I'm also Associate Professor at the Nossal Institute for Global Health here at the University of Melbourne.
And I think ahead of the conference, you're speaking in the opening session today, but ahead of the conference you issued a bit of a statement about what GPs can do. Was it GPs or general medical professionals?
Yeah, look, it was particularly for GPs, but it probably relates to medical professions in general. I think for many of us as GPs, honestly, we're sitting there, we're overwhelmed with care plans and clinical care and preventive care, and some of these big public health, global health issues all seem a little bit abstract and nothing to do with us. The thing is, GPs actually can have quite an important role in this climate issue. So there's lots of practical things they can do. They can get informed about climate change. There are some really practical clinical issues that come up, particularly as we're seeing more frequent and more severe heat waves. We're seeing more extreme weather events, and often GPs are the backbone of the primary care workforce. We're really at the front line. So there's lots that GPs can do. Then if they're feeling really motivated, they can actually participate in the public debates. And doctors have a very proud history of commenting on public health issues. And climate change is very much one of those issues. So we can comment on how are we designing our cities? How are we sourcing our energy supplies? These are things that doctors have always been able to contribute to in a very meaningful way.
There's actually going to be a media panel later in the day about that, about how what doctors could be doing.
Yes.
What would you like to see within those issues? What do you think individual doctors can actually talk about? Can they actually talk about patient experience? Because we do, as you said, doctors are at the front line of this.
Yeah.
What can they describe? What can you describe?
Well, I guess there's a slight caveat here. So if I'm sitting in my general practice and someone comes in for their repeat oral contraceptive script and you go, by the way, are you worried about climate change? I would recommend they not go back to that doctor. People are primarily concerned about their health, their clinical care, and it's important that doctors focus mainly on providing high quality clinical care. Having said that, there's some actually extraordinary links between what we call the non-communicable diseases, that is obesity, diabetes, inactivity, which are causing a lot of problems. And a lot of the solutions to these issues lie in things that are also good for the environment. Promoting active transport, walking, riding, eating local healthy food. So we call these the co-benefits. And there's an excellent professor from the World Health Organization, Sandro Di Maio, who'll be talking at the conference about why we need to restructure our societies so that they deal with these environmental issues and at the same time deal with these really big public health issues as well.
Now, the conference is happening at a very timely time. There's probably not a not timely time for climate change discussions at the moment, but we're seeing the impact now of Cyclone Debbie across Queensland and New South Wales. We're also seeing the closure today in Victoria of the Hazelwood Power Plant, which has a load of health remarks around that, not least that made by the AMA president. What do you want to see, the action emerging from this conference, and what do you think that organisations like the AMA need to do?
Well, that's a nice, easy question you've given me there this morning. Well, look, a couple of things. Certainly, we are seeing extreme weather events. We're always very cautious about drawing causation, drawing links. But, you can't say that one particular cyclone, for example, Cyclone Debbie, is caused by climate change. But what we can say is that climate change is loading the dice and it is creating more extreme weather events. And certainly what we're seeing is a pattern that is predicted to get more frequent and worse. So more stronger storms, more heat waves. The scientists, and we're hearing this morning from an excellent meteorological scientist who'll be talking about what's actually happening, what are the facts, what are the numbers. Now, your second issue about coal and Hazelwood. So obviously this is a very loaded issue, and I have seen the comments from the AMA. I'm speaking at the moment on behalf of myself. I am not on the Doctors for the Environment Australia committee, but on behalf of myself as a doctor, as a current member of the AMA, I'm very unhappy with those comments. I think that they really belie a misunderstanding of how serious this climate change issue is, how the world is really getting on board with Paris agreements and moving to much more sustainable energy supplies. So I think it's a long shot and really an inappropriate comment to say that isn't this bad for health that we're closing down these coal-fired power stations. So I'll see what the organisation DEA has to say, but their comments from Dr. Grant Blashki, I actually had my call yesterday from the AMA and they said, listen, you haven't paid your fee yet. And I said, well, I'm not paying it because I'm not happy with these comments.
And do you think the conference will take formal action on that, or should take some formal action? What do you do about that? Because it's quite a constituency, isn't it?
Yeah, look, it's not for me to say. I understand that the AMA has some quite good policies to do with climate change, so I find these comments really out of left field. And that's as me as citizen / doctor, not as the organisation.
I won't put you on the spot anymore, but any other speakers you're really looking forward to?
Oh, there's such a great group of speakers coming up. I'm really excited about it. If you're not doing anything and you're in Melbourne, come along. The other thing I should say, the energy here is fantastic. We've got all these young doctors, and these are, a lot of doctors are going to end up going down a little sort of clinical burrow where they provide good clinical care, and we're really happy about that. But what's great about these young doctors, our future health workforce, is that they're interested in these big public health and global health issues. So very excited about that.
Great to talk to you. Thank you for giving us a bit of a preview.